Welcome to The Digital Footprint, a podcast for leaders in healthcare, public health, and education who are looking to leverage technology to solve problems and make a big impact. In each episode, we interview innovators and entrepreneurs who are solving the most challenging problems facing these industries. Join us as we dig into the colossal tasks involved in bringing a new digital product to life. Welcome to The Digital Footprint.
Hello, and welcome to The Digital Footprint. I'm Richard Sims, and this podcast is brought to you by Tyrannosaurus Tech, an award-winning technology partner dedicated to designing and developing high-impact software products. Very excited to be joined today by TJ Muehleman, founder and CEO of Standard Co. Welcome, TJ.
Hi, how's it going?
Good, man. I'm glad to have you on. So at this point, TJ, I think I've known you about as long as I've known anyone in the Atlanta tech scene.
I'm sorry.
Although, of course, I know you are West Coast based now, but
That's right.
We first met in 2013. I had just moved back to Atlanta, and you were one of the first instructors that came in for my previous business, Tech Talent South, and we were very much in our early days. So you were teaching Ruby on Rails to the young and hungry engineering upstarts in town, and it was a lot of fun. You know, we've kept in touch since then.
Well, and you know what I love about that is we hired, I think, 7 or 8 people that came out of Tech Talent South. It was the best breeding ground for new talent. You know, I spent 3 months with people, and I was like, "You're the best in this class. Do you want to come work for us?" And you know, several of them still work for us.
Yeah, that's awesome, man. Yeah, and I know who some of them are, and I'm sure that how far they've come on the development front is amazing by this point. Okay, cool. So yeah, you were a great instructor, and you continue to be a great purveyor of all kinds of tech and startup advice, I would say. So I've checked in with you periodically to ask for feedback and advice, and you're always a good source for that. So I'm excited to get into it a little bit here on the show. So to get started, can you just take a minute or two, introduce yourself, and tell folks a bit about Standard Co?
Yeah. So my name is TJ Muehleman. Thank you. I was in Atlanta for 25 years. I moved there in high school, and then almost 4 years ago, my wife's from Seattle. We moved out here to Seattle, but my heart is still in Atlanta, I like to say. And thanks to social media, I mean, we all sort of bemoan social media. I'm still connected to Atlanta in a lot of ways. But Standard Co, I always like to start by telling the Standard Co story, by telling the We & Co story, which is my company beforehand. And so similar to you, I have a background in entrepreneurship that kind of predates this company. So we started We & Co in 2010 as the LinkedIn for hospitality professionals. So I was a bartender in college, and my dad was in the restaurant business for 50 years. So I had a real soft spot for hospitality. And we did the traditional startup playbook. You know, we did a friends and family round, we did an angel round, we were trying to raise an A round. And, you know, it was a real struggle. And right around 2013, 2012, 2013, we kept running out of money, and our investors were amazing. Gave us bridge loans and, you know, kind of kept us afloat. But after the third time, we kind of got tired of doing that. And we said, you know, let's take our skills, our unique skill set, where I was sort of somewhere between technology and sales. We had a really good designer and a really good mobile developer. And so let's start an agency to fund this business. And we did that, and it was really fun. We actually, our very first client was, we built Jason Carter when he ran for governor, Jimmy Carter's grandson. We built his website, and we were like, holy shit, this is fun. Like, let's do this again. And it pays well, and the client's really cool. So we kind of evolved into an agency that built things for other people to fund We & Co. And that was the beginning. That was 2013.
Mm-hmm. Yeah, that's awesome. So it does all tie together. So for Standard Co, one of the things that, of course, I admire about you all's journey is that, as you just mentioned, you all started very much as agency, kind of dev shop model, building out websites, apps, products for other organizations, service provider, very much like Tyrannosaurus Tech. But you all have slowly transformed into really a product company with your standard data toolkit. And I think everyone can appreciate the accomplishment that is, but I especially recognize it. And I think anyone in tech services, because it's very hard to make that switch, of course, and it is kind of the dream for tech services firms, right? Like everyone is like, yeah, but we're going to be launching our own products and we're going to be a product company. And we have those aspirations too, and they're sincere, but I know how hard it is. It's kind of the MailChimp 37 signals story that is very rare. So tell us more about that transition from services to product. Like, what has that been like? How long did it take? Love to unpack that a little more.
Well, I'll answer the last question first. It's ongoing. It takes a long time, but I'll kind of rewinding back to 2013, 2014, 2015. So we kind of, started the company as a dev shop to fund our other companies. So we were always at heart a product company. I've always had aspirations to launch and run product. Services it was sort of a means to an end, and we always knew it was going to be. So with our first company, I was a real big believer in founder market fit, that you had to have like a certain, passion and a certain knowledge about an industry to really start a company in that industry. And again, for me, it was hospitality, just because I grew up in it and did it a lot in college. And I realized that, at least for me, that was wrong. I was wrong to believe that was the only way to launch a product. And so with Standard Co, what we figured out was that there are a billion problems out there in the universe that require some sort of automation or some sort of intelligence or something that you don't necessarily need to have like domain expertise over. You just needed to develop that domain expertise over. So we decided to not come into launching a product in Standard Co with a certain bias or prejudice. We just said, we want to find some problem. And so we literally started launching stupid goofball projects. We launched, I think, 10 or 11 products over the course of 3 years, looking for something where there was a fit. So I'll give you kind of 3 examples. I always like to share these examples. So we started one called Dear Faye. That was for new mothers. It's like you have a new baby and you want to know, you had some question about breastfeeding, or you had some, issue with whatever it might be. You could text an SMS service. And that got some traction and some paying customers, but it didn't really go anywhere. And then we had one called Idea Shaper for innovation groups at big organizations for shaping ideas. And then we had one called Leon, which was a Slack productivity tool. And we did that like 10 times. And each one of those either gained some traction or some revenue, but they didn't quite lift off. And then the 11th or the 12th, I can't remember the exact number. And all the while we're doing services work to pay the bills. So we're building apps and websites and data systems and all kinds of shit. And around 2015, somebody at the Task Force for Global Health, which is based in Decatur, reached out to us and said, hey, we're transitioning our data collection activities from paper to digital. And we have a tool we're using in-house, but we built it and we're not technologists. We don't really know what we're doing. We want to scale this thing and we want to dial it up a little bit. And we were like, well, that sounds cool, but we don't know anything about healthcare. And they're like, well, we're not healthcare, we're public health. And at the time, I didn't know the difference really between sort of consumer health and public health. And I think now everybody through COVID has sort of learned that there are definite differences. And we came into Task Force and built like a prototype tool that was deployed somewhere in sub-Saharan Africa. And it was like, holy cow, this is super neat. And there's a clear need here because, there's public health organizations all over the world, the WHO, CDC, Task Force, non-governmental organizations who are trying to gather data and are using pen and paper or paper and pencil. And if you digitize that, you can get a whole lot of benefits out of it. So kind of long story short, we deployed that tool and it went really, really well. And so then we went and found somebody else in public health and said, hey, we actually know how to do this. Would you be interested? And they're like, yeah, of course. And we also had an internal champion who sort of helped, open a lot of doors for us because we made a really great relationship with this one person at Task Force. And that was a really kind of big signal for us that maybe this 11th or 12th thing that we built that we knew nothing about was going to be the product. And that was in 2015. And it's from there, it slowly started to kind of build to now, we'll talk more about the in between, I'm sure here, but here in 2021, 95% of our revenue is from standard data, our product. We still have a couple of legacy clients that are totally outside of public health that still pay us, and they're good people, and we have a wonderful relationship with them, and we're not really ready to get rid of them. But through that journey, one of the biggest, hardest decisions we made was quote unquote firing customers that weren't, didn't fit in the mold or were difficult to work with or whatever. We wanted to be a product company. So that meant sacrifice. That meant losing revenue. So that way we could really dial our focus in on building a product.
Yeah, that makes a lot of sense. And I think that what you're describing about having a development firm or an agency model, if you are deliberate about it, it gives you an incredible opportunity to experiment, because you obviously have this talent on board that if you can carve out some of their time and, still cover that cost with a lot of your services, it's a lot safer means to put some things out there, see what you learn. And I definitely appreciate how I think you all got into what ultimately became standard data. And it's a similar mindset we adopt, although, we're much less far along than you all, but is like, let's see what the market kind of leads us to as far as some consistency or just a thread that ties these problems we're solving across organizations together. So one question I had for you, which you've alluded to a little bit, in my opinion, the hardest part there is like, how do you balance those things?
Yeah.
And that is the challenge, is you have to, at some point, if your agency is doing well, you have to choose to forego revenue, pull people off of client work in some capacity, knowing that at least for the short term, this product is going to be nothing but a money pit. So like, how did you all kind of balance that over the years? And then how did it evolve to where you basically were like, we are essentially there where we're making the switch, you know?
I think for us, I'll say one of the key ingredients to this is sort of a dying passion to build, a real product that can change the world. To sound kind of cliche. Like for me, one of the things that I've really been passionate about my whole career is sort of this intersection of technology and impact. And how do we leverage technology to actually make a difference in people's lives, to improve the human condition, right? And so we think of what we're doing as aiding public health organizations to do that. And so in 2017, we had the product, and I think it represented about 35% of our revenue in 2017. And we were at this sort of pivot point where we could continue to be an agency and continue to push hard on growing our agency revenue. And by then we were doing over $1 million in revenue in services work. And I think we were on a pretty safe trajectory to doing by now probably 5 to 10 million in revenue as a services company. I think that was an easy thing for us to do. But we weren't passionate about it. We weren't focused on that. So we made a very deliberate decision to say, okay, we've got, at the time, I think we had around 10 developers, 10 engineers. Our team, the biggest we ever got was 15 people. And so I think right around then we took 2 or 3 of our developers, our more senior developers, and said, okay, you're only working on the product. The remaining team was services. And as a partner, there were 3 partners at the time. One partner was dedicated to the services side of the company. One partner was dedicated to the product side of the company. I was on the product side. And so we made these deliberate decisions to start separating the company really into 2. And people kind of went back and forth at times. Sometimes the product teams flopped over to the services business to help out, and vice versa. And even the services team was afforded about 20% of their time to work on product. And because at that point we were like, I would say mostly certain that standard data was going to be the product, but we were still kind of goofing around with other things. And so I think it was making deliberate decisions to bifurcate the company a little bit, and making deliberate decisions to say, in 2018 we pulled another developer over, and by 2019 another one, and then at the same time, our revenue did kind of was doing this whole spike thing, and then it flatlined, because that's when we started saying, okay, this customer is really needy and really hard, and they're not public health, and they're not contributing to the vision of the company. So when their contract is over, they're out, and then this client is out, and then this client is out, and so we were able to kind of our revenue kind of flatlined there for a couple of years, and then started to pick back up in 2020, well, at the end of 2020. But our team shrunk, because one of the benefits to having a product company is you can do a lot more with a lot fewer people. And in fact, most of our work now, I mean, we're always innovating and always adding new things to our platform. But when we have a new client, we're not coding anything for them. We're configuring things for them and standing up. So that doesn't require quite as much engineering talent. So it just meant like sort of we were an engineering heavy company, and now we're sort of more of a customer success heavy, more marketing heavy, and sort of consultative, like, here's how you can use standard data to solve your problem.
Yeah. Awesome. That makes total sense. And yeah, I love that it was a very gradual transition, just kind of, quarter by quarter, year by year, making the move. So let's talk a little bit more about standard data. I know the toolkit is made up of essentially 3 products, right? There's what you all call collect, manage, analyze. Can you tell us just high level about the toolkit as a whole and those products and kind of how they work together?
Yeah. So the problem we're trying to solve is how do we get information from the field to analysis as quickly as possible? So 10 years ago, COVID happened, when Ebola happened in 2008, 2009, and it still kind of flares up, but when the main outbreak happened, what they would traditionally do is they'd send people into the field to understand who might have Ebola, who might have been in contact with somebody with Ebola, what have you. And they would collect all this data on pen and paper. And so they'd get all this information. And then maybe halfway through the survey, they're like, oh shit, this question is kind of wrong. We need a new question. We need to change it. Write new surveys, deploy new pen and paper and pencil, and then collect all that data, aggregate it, get it into a data system. And that whole sequence might take months, right? Well, our platform digitizes that whole thing. And so from the moment that somebody comes to us and says, I want to collect data in the field and understand what's happening with COVID, for example, we have a survey tool that runs on Android and iPhone that from the moment they come to us with the questions they want to ask to them actually interviewing people in the field can be as short as 48 hours. And a real world example of that, I'll tell you, is COVID. So when COVID first broke out in March of 2020, Merck, the Merck Foundation, so Merck, the German pharmaceutical company, was sponsoring a survey in Nairobi around COVID. So they wanted to interview 10,000 households. And so they came to us because we worked with Merck on a bunch of different things. And we created a survey in 48 hours that allowed them to go to 10,000 households, interview people about, did they understand the difference between COVID and malaria? So in North America, we talk about COVID and flu and pneumonia as sort of a packaged goods. In sub-Saharan Africa, they talk about it with malaria a lot. And so they wanted to collect all this data. So that data gets collected on our apps, immediately gets sent to the cloud. But the cool thing is it works with or without internet. So you could be out in the middle of nowhere and you're collecting all this data. And as soon as you get to a Wi-Fi hotspot, it'll just zip it up and shoot it over to us, to our servers. So then the managed component kicks in, and the managed component actually cleans the data and looks for outliers and puts it on a map and does all kinds of stuff to basically do some of the more, onerous tasks that people do with managing data. And then that's the middle component. So or some people might think of it as data engineering. And then the last piece, which is sort of the newest component to our platform, is the analytical side. So what used to happen is people would do all the first 2 steps, collect all this data, we do all this data cleaning, make it easy for them, and then they'd export the data and they go put it in SAS, or they go put it in R, or they do something with it to create a report like, okay, COVID or Ebola or whatever is, here's a map of where it's happening. And so what we realized was people kept asking us to do the analysis, and we're like, we're not qualified. We had this imposter syndrome where we're like, we're not data scientists, we're data engineers. And then we realized that what they were asking for was actually pretty basic stuff. Like, show me a pie chart of how many males and females I've interviewed. Show me a bar chart of how many, villages I've reached in the last 30 days. Show me a trend of how many, what it's going to take to get to 10,000 households. And we were like, oh, we can do that. And so the analytical side came in when we adopted an open source platform called Metabase. And now we're a holistic tool. So we're running a whole bunch of COVID studies right now in South America and Africa, where the clients using us, it's like a turnkey solution. Like, they don't have any data analysts on their team. They don't have any data managers on their team. They don't have any programmers on their team. We're doing all of it. So that way they can kind of focus all of their attention on understanding the disease, understanding, or the virus, understanding where it might be happening, and understanding where it might be going. So that's kind of what we're doing is a turnkey solution for these global health organizations.
Yeah, that's a great overview. And one of the things I really appreciate about it is that it is very broadly applicable. I think you all have correctly focused on public health, and I'm sure there's a lot of aspects of the product that are specific to public health, and I know that that's where you all want to work and have a big impact. But these are very common problems that there's a lot of sophistication in what you built, but it's not rocket science. Like, hey, people are doing this in this very manual way. We can build something that make their lives easier, help them, save money on all these efforts and have a bigger impact. So I think that's really cool. One thing I was going to ask, you've mentioned this to me at some point, but what percentage of your clients are, outside of the U.S. as far as based, and then the product itself, if I remember correctly, is overwhelmingly used outside of the U.S. and Africa. I'd love to just understand how folks are using it a little bit more.
Yeah, so I would say we have probably 10% of our clients are U.S. based. So we actually have non-public health clients. To your point, like, we have developed as a company a domain expertise on public health, data systems, and humanitarian logistics. Those are our two kind of areas we spend all of our time. But the product itself is not really designed specifically for public health. So we have an ice cream company using it. We have a dev shop using it. We have a bunch of NGOs who do some humanitarian public health and some don't, and some mission-based organizations using it to kind of measure their progress and their impact. And in fact, that's where we see our growth areas going, is we're actually kind of expanding that side of the business. And then in terms of usage, 98, 99% based outside the US. So it's really funny, when COVID hit, everybody was like, oh, TJ, are you going to, go work with, domestic organizations, public health departments? And for a couple of months, we wanted to. We were like, what you're trying to do in terms of coalesce all this data, in terms of make sense of what's happening with COVID, is exactly what we do for about 10 different diseases around the world in over 164 countries. And when we talked to public health groups here, they were just sort of like, they didn't know what to do. They had no idea like how to deploy a tool like this, because they're kind of stuck in 1999. And I've been very public about this, about the problems we have with our digital infrastructure in the public health system here in the U.S. So that's a long way of saying, like, I'm much more comfortable. I know more people in the Ministry of Health in Kenya and Tanzania and Cameroon and Ghana than I know about here in the US. Our tools are not just our tools in general are much more likely to be adopted and utilized in, I think, a more meaningful manner in Africa than they are here. And I've said, several times that I think if we wanted to understand how do we better deploy technology to combat, disease here in the US, we should look at how we're doing some of that technology in Africa, because I think it's a little more forward-looking and meaningful. But it does pose challenges. I mean, we've talked a little about this. Some of it's practical, like, before COVID, I would travel to Africa 2 to 3 times a year, and I'd travel to Europe 5 to 6 times a year. I was traveling internationally almost every month, and that's hard, especially when you have kids. And then when I'm not traveling, I'm up at 4 a.m. for calls because my good friends in East Africa time zone is about 9 hours from here. So it does make things challenging, but it's rewarding because you see how they're using these tools to actually make an impact. And it's I'm hesitant to say this. It's always hard to say, but I prefer working with our friends internationally than I do domestically, because I feel like here we're just sort of so caught up in bureaucracy and politics than we are in actually solving problems.
Yeah, no, I hear you. And that's a good segue of sorts, because as much as we are all sick of talking about it, no pun intended, COVID is very top of mind.
Yeah.
And I remember a few months ago, I texted you out of the blue because I was just driving around listening to NPR, and legitimately I was like, this sounds like TJ. And then after a while, it just became very evident it was you. And you were on there talking about COVID, but specifically the COVID mapping project, which I know is something you and Standard Co have invested a lot of energy into. So I'd love to know more about that and kind of how that came to be. And to what extent is that something where you're largely leveraging like technology you already had in place with standard data, or is it totally separate?
Yeah.
Love to hear more about that.
So the story, I think, is kind of interesting because I was actually in Geneva, Switzerland at the end of February 2020. So there were a handful of cases here, or diagnosed, confirmed cases in the US when I left. In fact, they were doing temperature checks when I left, and I was like, what the hell is going on? I know that COVID's a thing, but I didn't realize it's a big deal. And so I go to Switzerland, and in fact, I'm sitting at WHO, World Health Organization headquarters, in a meeting with about 60 other people about a completely unrelated thing. And everybody starts looking at their phone. People are getting alerts. And it was the first confirmed case of COVID in Switzerland. And we were all like, what's going to happen? And so when I got home, my phone had been blowing up while I was gone. People asking me like, hey, TJ, what's going on? Because they knew me as a public health person or data person. What's going on with COVID in Texas, where my family lives? What's going on with COVID in Georgia, where I'm from, and most of my friends are? What's going on with COVID in Washington? And at the time, you had to go to the State Department public health websites and download PDFs and like, okay, well, there's 65 cases in Washington, and Texas has 200 cases. And it was just this kind of mess. And I was like, well, this is exactly what we do. We either have people collect data with our tools, or we collect secondary source data, through PDFs and Excel spreadsheets and all this stuff. We standardize data. So we take data from all these places and bring it into one place. So it was like March 12th, I bought the domain name COVID Mapping Project. And I was like, well, we can take standard data and we can point standard data instead of African data and South American data and South Asian data. We'll point it at American data. It'll work. And in fact, it did. So we built a website called COVID Mapping Project where you could go, and this is right around the same time that COVID tracking came about. And COVID tracking was the big one with, the Atlantic was backing it, New York Times and Johns Hopkins. And we weren't really competitive with them because they were just doing data, and we wanted to do very straightforward visualizations. Mm-hmm. And so we wanted, I always call it the mom test. My mom is 77, and a really bright woman, but she's not a technologist. I wanted to be able to show her a map and a trend line, and for her to be like, got it. I understand that COVID's going up or it's going down, or it's bad or it's good. That's it. And so we built the tool to be a layperson's guide to what was happening with COVID. And so that was in March, and we've now had 4 big evolutions of COVID Mapping Project. In fact, it's still running. It's all automated. So every night we update 50 states, 3,000 counties, and that's common indicators like mortality, hospitalization, testing, and cases. And we've on purpose made it very simple, again, because at the time what we also found was, if you went to Twitter, it was one epidemiologist sharing with another epidemiologist, a chart that, if you showed it to my mom, she'd be like, what the hell am I looking at? And so we thought that the public health communications around COVID was lacking. It was not speaking to the commoner or the common person or the layperson. It was speaking to other scientists. And that's one problem you still see in public health is they have a difficult time, a lot of them communicating with the moms and dads of the world. They're so used to communicating with other scientists. So we wanted to streamline it and make it simple. That was our goal.
Awesome. Yeah. I've explored that a good bit throughout the pandemic and have found it very helpful. And, one thing I very much appreciate about your perspective on technology is, I think you are not into tech just for tech's sake, right? Yeah. I've always perceived you to be someone that views it as a tool.
Yeah.
You're not necessarily over the moon for this particular programming language or framework. It's all about what are we going to do with this, to make an impact, to help people to solve the problem. And I love that. I mean, and we experience a lot of that here at Tyrannosaurus Tech too. We do some stuff that is much more sophisticated, but honestly, most of the stuff, it's not some AI blockchain enabled. It's taking things that are just, decentralized, like you said, right, and kind of bringing them together so that they can be analyzed or more actionable or, especially in the public health space, so much of it is just getting information into people's hands that, previously had been inaccessible or unapproachable. So I love the stuff you're saying there about just trying to make it, really easy for everyday folks to use and get value out of.
Yeah.
So taking a step back, from your point of view, like how has COVID reshaped the public health landscape? Because I feel like, and from folks I've talked to, one positive, at least in terms of kind of public awareness, is it's drive more awareness of epidemiology, how connected our societies are, the threat of things like pandemics. Hopefully we'll be better prepared in the future. On the other hand, I've also had the impression from folks in public health that, in a lot of instances, COVID has kind of sucked all the air out of the room for other very important public health initiatives that were, put on the back burner. So I'm just curious from your perspective, what that's been like over the last couple of years.
Yeah. I'll tell like sort of two anecdotes that that kind of speaks to that last point about how it sucked the air out of the room. One KPI we look at in terms of like how used is our platform is how many surveys are done once every week. So that's how many people have been interviewed on our platform out in the field. And in February, it was like 120,000 surveys we processed in a week. So we did, 500,000 surveys a month. In July of 2020, kind of in the middle of the second wave or the beginning of the second wave, it was down below 1,000. So you went from 120,000 a week to below 1,000. So that is a reduction of 119,000 fewer people are being asked about what disease they might have unrelated to COVID. And in fact, those 900 or those 1,000 people that were interviewed on our platform were sort of COVID test projects that we're doing. So global health came to a screeching halt. And it was really eye-opening. And it's sort of like, oh my God, what about these other programs, to your point? What about measles? What about polio? What about neglected tropical diseases? And the other piece that we saw was that the other side of our business that we haven't really talked much about is humanitarian logistics. So one thing we do is we help, supply chains, all the buzz right now. And where are my AirPods? That kind of stuff. Why is it running late? Well, similarly, drug donation programs. One very big component to what we do is we help the pharma companies, so GSK and Pfizer and Merck and Johnson & Johnson, we help them coordinate where they should send their drugs to treat a variety of diseases. So they use data to do that. And so those drug donation programs for a good 5 or 6 months just basically stopped. And so you're talking about millions of people who weren't getting medicine to prevent them from getting diseases that and let me be very, very, very clear. Like COVID is dramatic, and we did the right thing, but it has sort of a cascade effect of bringing these other programs to a halt. And I think we're going to be unwinding the effects of COVID for years to come. Societally, we could talk about that as another conversation. But from a purely global health perspective, it did bring real change. And in fact, I was talking with a client today who was getting ready before COVID to do a really neat case study, a test in Cameroon on doing not only interviewing people in the field, but actually diagnosing them in the field, without a lab. So it was a mobile lab, all on iPhones, really neat high-end stuff. They were going to do that before COVID, and they basically put a stop to it for a full year because of COVID. So there was all kinds of cool innovations that we're getting ready to launch. So I think that those are the things that we have to figure out. But on the flip side, on the positive side, and now I'm speaking here in the U.S. and I'm speaking kind of maybe as a parent, is that before COVID, we would send our kids to school with a sniffle, and we're like, oh, did they have a temperature? No, you're going to school. Now, I think with masking, I think we're going to be much more proactive. And this is, I think, the next evolution of COVID mapping project is going to be about proactively telling people like, hey, there's an outbreak of flu in your neighborhood. There's an outbreak of COVID in your neighborhood. You should probably wear a mask today. You should probably keep your kid home, whatever. And I think we'll see a lot more intelligence around illness and proactive illness arbitration. And I think that's something I'm excited about, again, as a public health technologist, but also as a dad, because it sucks for my kid to be sick. And if we can reduce that, then that's a bonus for everybody.
I'm right there with you. And I've talked with folks about this, like our daughter is 3 or she'll be 3 in December. And of course her school was shut down for a couple months early on. And we put her back in fairly quickly when they opened up because we love the school and we felt comfortable. But knock on wood, I don't want to jinx it, she has not been sick once.
Yeah.
Which is insane because, of course, before that, standard like daycare stuff, she would come home, we would all get sick, it would go through the house. So, yeah, man, it's like the masking and just some of the best practices and cleaning for surface transmission. I mean, obviously it affects a lot beyond COVID. So I'm very grateful for that. Yeah, right there with you. So changing gears a little bit, we started this podcast primarily so it could be a resource for folks who are either in the process of or thinking about launching new products, generally in healthcare, public health, obviously, education. Startups are very hard. I feel like you are the last person I need to tell that to.
Yeah, I don't need that. I agree.
You definitely are very real when it comes to, I think, perspectives on the startup world, challenges of startup life. And that's one thing I think I and others in the community appreciate is you don't pull your punches on this stuff, which is healthy. Like we try to be the same way. I mean, startups are hard. You need to know that going into it. You need to know that there's a lot of things you can do to mitigate risk or improve your chances of success. But, we always tell people it's like if we could pick the winners, I wouldn't be sitting here. I'd be, on a beach somewhere, retired, right? So for Standard Co., what are the biggest challenges you all have faced over the last couple of years, specifically as it relates to jumping into product? And kind of how have you overcome those? What comes to mind?
I think the biggest challenge is that because we've very deliberately decided to bootstrap this business, we haven't raised outside capital. I think that has made us we have had to be really focused and really intentional with our decisions. Again, going back to, taking the company and sort of splitting it in two and, separating, taking employees and dedicating the product and non-revenue producing employees was a really hard. And doing it on our own capital and doing it, I like to call it customer financed or customer investment. So we would get customers who, we would make sure that they would pay for things and we would incorporate that into the product. So those decisions, I think, were really they were hard. And I think that's the trickiest part about going from services to product is you also have to be patient. I think when when you live in the startup bubble, what you're used to seeing is speed and overnight success. Because that's the story that sells, right? You talk to any tech reporter and they're like, look, I would love to tell the bootstrap story, but nobody wants to talk about the fact that it took you 10 years to figure out how to tie your shoes, right? They want to know that you did it in 30 minutes and then you sold the company for $10 billion. And so those stories sell. And then it kind of it gets in your head and you start thinking like, I'm doing things wrong. And in reality, those instances of the big success and the overnight success and the blitz scaling are edge cases. They happen, but they're as much luck as they are anything else. The founders will tell you that they made deliberate choices for that to happen, and I'm going to tell you that's full of shit. And so they got lucky in a lot of cases, and that's having a front row seat at some really smart people who just kind of plugged their way into a tidal wave and just rode it all the way in. And so I think learning to kind of ignore that hype and just stay focused and stay like true to your mission and true to what you want to do is really hard. And a couple of years ago, like we had been very deliberate about not raising capital. And then I will be the first to tell you, I got sucked into, like, we had sort of had a really big year, we'd grown really fast and things had gone really well. I'm like, what if we just raised a couple $1 million? What would we do? And we tried to raise money for about 4 weeks. And I realized how much I did not enjoy it, and how much it wasn't for me. And I had sort of lost myself a little bit in the ecosystem. And so I always tell new founders, I'm like, if raising money is your thing, if blitz scaling is your thing, go do it. Like, that's awesome. It's not for me. And it's not for a lot of the people in my cohort, or the people that I sort of look up to. I'm very about deliberate authenticity, about not deliberate authenticity, but being deliberate about my choices and being authentic to me. That's the thing that makes me tick. And every morning I wake up and I'm like, could we be a bigger company? Could we be doing more? Probably. But would I be happier? No. Would my team be happier? No. We get to do a lot of things otherwise we wouldn't be able to do. And I'm very, very happy that we've chosen the path we're on.
Yeah, that's a great answer. And I am right there with you. I think that we all struggle with some of the noise in the industry and what's glamorized and reported on.
Yeah.
And of course, the folks that, especially here in Atlanta, is of course what I monitor, the people that are having big wins. I mean, I'm so happy for them, and it's good for all of us because, it brings more attention and talent and potential for investment to the area. But
right.
It's very hard to not get sucked into feeling like you should be doing something bigger.
Oh, totally.
And, we also know that as much as raising money is an accomplishment in itself to a degree, it's like that is just the beginning of wherever that roller coaster is heading. Like, that is not defined success, right? And the unfortunate reality is a lot of folks raise money and it's not like it's, a fairy tale after that. So you kind of have to take it all with a grain of salt, I think.
Yeah, I always tell people that these numbers are just sort of pulled out of thin air. But when we raised money for We & Co, we probably spent thousands of hours getting pitch decks ready, going to pitch competitions, dealing with investors, and we probably spent hundreds of hours on the product. I mean, the calibration was out of whack. And I think at an early stage, it's hard to get that calibration right unless you're just really good at raising money. Whereas with Standard Co, we've spent dozens of hours talking to investors and thousands of hours on customer and product. And that, again, that calibration for me feels right. And the flip side is we own 100% of our company. I don't got to tell anybody what the hell I'm doing. My family and I did a 4-month road trip from March to July, and I worked from the road. And if I had a board of directors and investors, they would have lost their minds if I told them the CEO was doing that. And in fact, the interesting thing about that is that quarter, I was gone for almost an entire quarter. It was the most productive, the best quarter from biz dev and revenue we've had in years. And so this whole idea that you got to throw 80 hours a week into, everything. Now, early in your career is a different story, but I'm 44 years old. I want to do things the way I want to do them. And if it means it takes me, I might be in my 60s before we hit massive success, I'm okay with that. Mm-hmm. I'm happy with what we're doing. I love our customers.
Yeah, I totally respect that. And I think the value of that lifestyle, and I think striking a balance between being able to do your own thing and find success and do something really interesting, but not feel like you have to burn yourself to the ground is great.
Exactly.
So for Standard Data, what does success look like in your mind, let's say 5 years from now? What impact do you hope you all can have with with the product?
So I think there's a quick little story I'll tell you, and it's sort of where I hope we go with the whole platform. And from a public health perspective, one thing we want to do is increase the speed to get meaningful and impactful data so that decisions can happen more automatically and happen more efficiently. And a good use case of this is on the humanitarian logistics side. So we monitor all these indicators about the delivery of medicines, and we publish that data to the public. And we started doing that in 2018. And a bunch of smart people at the task force did a case study on the platform that we built from 2018 to 2019. And what they figured out, what they saw was that the tools that we built, and they actually tied it to the tools, helped reduce how long it took to get medicines to these 105 countries. It reduced the amount of time by a month. Okay, so it was 9 months, and because of the tool we rolled out, it went down to about 8. Now, this is almost 2 billion tablets of medicine to 100 some odd countries that we're now monitoring all of this and shooting out alerts, say this thing is running late, you should go talk to this person, and oh, this is missing this customs doc, blah, blah, blah. All this stuff is now automated. And if you think about that, a month, reducing things by a month means millions more kids are getting treated for these diseases than they were before. They're getting treated on time. They're getting treated with these medicines that aren't languishing or expiring in warehouses or aren't, getting stolen or whatever. And so when I think about where do I want to go, I want to take that use case, that particular little example, and expand that. So I want people to use standard data to understand where disease is happening, where it's going to happen, and how do we mitigate that? How do we prevent it? How do we get medicine and treatments and vaccines out to places before they realize they even need them? And really, again, take this idea of all these really goofy data sets that exist in the world and bring them into one place so that way we can actually understand what's happening, and provide that data to whether it's public health organizations like we have clients in Africa and WHO and CDC, or small NGOs or whomever. I really want to see that data shed more light on what's happening and how can we make the world a little bit of a better place.
Very cool.
As cheesy as that sounds.
No, I mean, I know it's sincere, and that's a really great example that you've shared, and I think all of us in tech, there are so many great products out there and there's great opportunities, and, I don't even want to imply some are better than others, but it is great to work on something that you can really see a tangible impact.
Yeah.
It's not just, another Tinder-like dating app or something like that. It's something you can really find fulfillment in and, tell your kids about. I think that's awesome. And again, it goes back to kind of viewing technology as just a very open-ended tool that can do a lot of amazing things if pointed in the right direction. My last question for you, which is a big one, you might have to do a quick inventory in your head and distill the list. But for someone listening who's in the early stages of pursuing a new product or thinking about taking the leap and pursuing a startup, what advice would you give to them that are kind of some of your biggest takeaways from the journey you've been on?
I think there's a couple. I think one is patience is key. The best founders, I think, the best founders that I know have stuck with it, right? It's really hard to start something and see success in the first year. And a lot of people are like, oh my God, that sounds terrible. And it kind of is. So you have to enjoy the journey. You have to enjoy the process of building something from scratch. I talked to a founder in Atlanta that I really love and really respect. And he made a really interesting point to me that he was like, I think I'm a founder. I don't think I'm a CEO. And I think we conflate the two a lot. When I said, unpack that a little bit, he explained, he's like, I love starting things. I love getting things to a point where like we're inventing the employee handbook and we're inventing the onboarding guide and the product and all these things. Like, but once we get to a certain point, then all we're doing is scaling that. He's like, I don't do that very well. And I sometimes wonder if that describes me, pretty well. I love starting things. And I love building things. So you have to kind of enjoy that journey. and that heartburn. So I think patience is key. Or you can distill it down to a simple, axiom like don't die. Like that's all that matters is don't die. And if you can do that, then building a startup is the most rewarding thing professionally I've ever done. And I just absolutely love it. And then the second piece is I do think I'm now a big believer in sort of authenticity and sort of trusting your gut. Like what do you want to do, TJ Muehleman or Richard Sims or whomever? There's 1,000,001 people out there who will tell you that you got to follow these steps and you got to do these things to kind of build an impactful startup. But if you do that, great, go for it. But if that doesn't really resonate with you, and it didn't resonate with me, and it sounds like it doesn't necessarily resonate with you, like trust your gut and follow what you think is the right way. And in a lot of cases, that will lead to a more rewarding outcome. Maybe not the most financially beneficial outcome, but a rewarding one where you feel good about the work you do, you're comfortable in the work you do, you get to do cool shit. And if at the end of the day, like it becomes a financial reward for me, awesome. But right now that's not my goal.
Yeah, that's all good advice. And certainly in startups, there is no playbook or roadmap that has really any proven success either. A startup game is just always a gamble, and people, find great success coming at it from totally unconventional directions. So I'm right there with you. You might as well, read up on success stories, know what's out there, but don't feel like you got to kind of follow these particular parameters if they don't feel right for you. I think that's great advice. All right. So I think we are about out of time. Thank you so much, TJ, for doing this.
Yeah.
It was a lot of fun having you on the show. I knew it would be. Before we sign off, where can listeners go to connect with you and learn more about Standard Co?
You can Google Standard Co. Or go to standardco.de. That's our website. You can follow me on Twitter. I tweet a lot about my dumb kids and nachos, but also data at TJ Mule.
Awesome. All right. Well, thanks again. Appreciate you coming on The Digital Footprint, and we'll see you later, TJ. Thanks.
Thanks so much.
Thank you for listening to The Digital Footprint. This show is brought to you by Tyrannosaurus Tech, an award-winning technology partner dedicated to designing and developing high-impact software products. If you like what you heard in this episode, make sure to subscribe to the podcast on Apple, Spotify, or wherever you get your podcasts. For show notes and access to all episodes, please visit tyrannosaurustech.com/blog. Digital Footprint.